COVID-19 is perhaps one of the most devastating health pandemics that has affected the social, economic, and health situations of everyone across the globe. Uganda is no exception to this. The information that was received in the local population was filled with a lot of fear, panic, and anxiety.
The government instituted initial measures against the virus, such as lockdown of schools and institutions. No one ever thought the effects would be devastating until people ran out of stocks of food and supply.
As in many of our projects, we have to be adaptive and flexible. So also in our Ideal Uganda program. In Ideal Uganda, we have a collaboration between Dutch and Ugandan municipalities. And we found that both our contact persons at the Dutch level as well as the Ugandan level are responsible for corona response. So we thought it would be a good idea to bring the two together.
Hi guys, nice to meet you. My name is Max and I'm working for the Municipality of Valkenswaard.
Let's start then. By the end of January, the first cases were noticed in Europe. We talked to Bo and Sam in preparation of this meeting to find some parallels between the Dutch and Ugandan system. And we see that it's almost the same. So we have both 3 layers in the national way, in the regional and in the local. Our Prime Minister thought that an intelligent lockdown was the best for the Netherlands, because if you tell a Dutch man or woman that you cannot do something, they probably will do it. But if you explain why it's best not to do so, most people will conform to those rules. So that works for the Netherlands.
My issue is we had kind of a quick response, more like similar to your situation. But presently, we have this laxity. Kind of like we are getting tired of the lockdowns and all these controls. They don't go here, don't be in this meeting. And it's kind of dying out. And even the enforcement is dying out. I'm just curious, how are you keeping up the fire within the community, not just within the local government, but just within the community, so that everybody watches out for the other?
We have the same problem. How we try to cope with that is that our Prime Minister says and tells people in his press conferences, this is all about you. If you act well, you get more freedom. And if you don't act well, we are, unfortunately, we have to get stricter measures again.
How are you handling the school-going children? They've been home for now close to 3 months. And you cannot keep them in one place.
Schools in the Netherlands are opened up again now. So first we closed them down because it wasn't clear for our health experts if what the role of children was in spreading the virus. And the advice at that time was that they could play outside and that it wouldn't be a problem if they came in close proximity to each other. That's the Dutch way, but there are a lot of other ways.
Then the other issue is also Dennis hinted about it, but I just wanted maybe to hear from you what has been the impact of COVID on the economy of the Netherlands.
All the local governments have indicated that they are receiving less income by local revenue. So VNG, together with its members, basically have negotiations also with national government to basically see how they can, well, be assisted through this period. So they have asked the national government if more money can come to local level to fight this point also.
Then there is also, lastly, the issue of stigma. For example, I have a close person in my area who cannot move out of his house because he recovered from COVID, and everyone who sees him everywhere thinks this guy still has COVID.
Some people are hesitant to have contact with an ex-COVID patient. Mostly that can be helped by educating your citizens. So you have to educate people that when someone is healed from COVID. They don't have COVID anymore and they cannot infect you.
I thought it was very interesting to hear all your questions and your perspectives and the comparisons between how we deal with COVID in the Netherlands and Uganda, but also the difference in perspective and stigma. I found that very interesting. Really big thank you to Max and Karin for preparing the presentation and for all of you for being here. It was very interesting and a good experience. So thank you.
Thank you all.
Thank you too.